This week we're going to talk about surgical asepsis, which differs a little bit from medical asepsis, which we spoke about the last time we had lecture. Medical asepsis, we're removing the microorganisms as much as possible through mostly disinfective methods. Versus surgical asepsis, we're going to use a process called sterilization. So we're going to destroy all of the microorganisms and spores from all the equipment and the area in which that we're going to work. There's a lot of different methods of sterilization. Chemical sterilization is an option. When we're using this for the process of doing surgery or in a surgical field, we don't really use chemical sterilization as much. But in certain procedures, you might see some of the tools being used soaked in a germicidal solution. It is less satisfactory than some of the other methods that we can use because there's a lot of different ways that contamination can occur or that maybe the solution wasn't as strong as you needed it to be. It didn't soak for long enough, temperature control issues, things like that can make the actual sterilization process difficult. Autoclaving is the most common method used. It's the quickest and most convenient method as long as whatever tools that you're using or autoclaving can withstand heat and moisture. There's other methods in case there are tools that are more plastic-based that can't withstand heat, but this is something that uses specifically steam to destroy all of those microorganisms. On the other hand, we can use conventional gas sterilization using ethylene and freon gases for items that can't be autoclaved, things that can't withstand heat. So it's super effective, but it does have the drawbacks of the gases themselves being poisonous, so it has to be in a very controlled environment. And it can be a lot more time-consuming than autoclaving itself. A trade-off is gas plasma technology, which is very similar but doesn't have those toxic byproducts. It's also more cost-effective, and it's able to sterilize more items, so in a greater volume. So it can be a little bit more time effective as well. However, there are some items that cannot be sterilized using gas plasma, such as those with long layer alumina or cellulose-based items, so it can't fully replace the gas sterilization process. Some items have sterility indicators, such as indicators that change color when sterilization has occurred, so you can tell whether a pack of tools used for surgery has been sterilized completely. Sometimes you'll also see tape covering an item that once was a different color or now has a new pattern to indicate that it is now sterile as well. The sterile field is the microorganism-free area, so this is where the actual operation will take place. So from the waist up is considered sterile, and anywhere where the patient is in the operation will be taking place is considered sterile. Everything waist down is considered non-sterile. So there's a lot of different methods and rules for maintaining the sterile field that we'll talk about. If you're assisting the surgeon in any way, most cases you'll just be present, but you might wear multiple hats depending on what your other qualifications are. So establishing a sterile field, you'll be placing the pack of tools on a clean surface within reach of the physician. Just before the procedure begins, you'll break the seal and open the pack. You'll always unfold the first corner away from you, and then unfold the other two sides. Pull the front fold down towards you, and then drop it. If you touch the inner surface, it's considered non-sterile. The inner wrap, if there is one, is open in the same manner. Front corner away from you, the other two sides. The front fold down toward you, and drop it. So that is the sterile field. There's a lot of ways to contaminate the sterile field. So if there's any sterile object, or if the sterile field itself is touched by an unsterile object or person becomes contaminated, you can never reach across a sterile field. Organisms could fall from your arm into the field, and it increases the risk of brushing the area with your uniform, which is considered non-sterile, especially from the waist down. If you suspect an item is contaminated, just discard it. So anything damp, anything with a broken seal, any items that the indicator tape has not changed to the correct color to show sterility can just be discarded. Never pass between the physician and the sterile field. That contaminates the field as well. You can never leave it unattended because you never know if it's going to become contaminated. And a 1-inch border at the perimeter of the sterile field is called a buffer zone, and it's treated as if it were contaminated. So the sterile field is very kind of strictly kept, and you know exactly where the boundaries of the field itself are. You may be thinking to yourself as we're going through this, when am I ever going to be doing this? There may be cases in which you have to take imaging while you're in the OR with a surgeon. So it's possible that you'll have to remember how to maintain a sterile field when you're in these conditions. So it could be ultrasound, you could be ultrasound guiding a physician, or it could be something along the lines of taking x-rays during a procedure. All of these are possible, so it has to be said kind of how this is going to go. Of course, the first time you do it, there will be somebody there to kind of walk you through the steps, and often during orientation they will show you where all these materials are. When you're doing sterile procedures or assisting in them, you'll have to prep your skin. So there's a specific set called the skin prep set, and a bottle of antiseptic for painting the skin. It includes a basin, liquid soap, gauze, sponges, razor, towels, forceps, and a medicine cup. You'll perform typical hand hygiene. The patient will likely already be placed in a comfortable position. You won't have to assist with that generally, and they'll have their privacy. If you do have to explain what has to be done, then you can explain the procedures that you're going to be performing, and then the area that is going to be operated on is usually exposed, slightly larger than the prep site. Patient should be covered to protect them from modesty concerns. If they have to have hair removal, then you use a dry razor to shave a small area at a time, holding the skin taut and shaving with short, firm strokes in the direction of hair growth. Same thing applies if you're using an electric razor. Once the hair is removed, then you'll wipe the area with a sterile gauze sponge wetted with alcohol to remove the rest of the hair that is kind of still sticking around. Then you'll perform hand hygiene once more and don sterile gloves. There's a whole step process to that as well. You'll pour a little bit of the antiseptic into a waste container to clean the lip of the bottle and fill the medicine cup with antiseptic. Then you will grasp several gauze sponges with the forceps and dip them in the antiseptic and start to paint the skin with the antiseptic, starting in the center of the area and working outward in a circular pattern similar to what we showed you guys in venipuncture, so that we're not just spreading those germs around in the same space. Do not scrub harshly. We don't want to create abrasions, but remember that we do need friction to actually cleanse the skin and get rid of those microorganisms. Then you can discard the sponge and allow the skin to dry. Then you'll repeat once more. Next, you'll open the pack containing the sterile drape or sterile towels. The physician wearing surgical gloves will drape the area surrounding the prepared site because they know exactly where they're going to make their cuts. There are two different options for getting your hands prepared for a procedure such as this. One is the traditional kind of surgical hand scrub. So you'll wear surgical attire and appropriate personal protective equipment, PPE. You'll adjust the water flow and temperature and wet your hands, getting some soap and water on there to make a lather. You'll wash all the way up to your elbows, through your forearms, and use a brush or scrub and soap to clean your hands and nails and underneath your nails with the nail cleaner. You'll then rinse thoroughly, keeping your hands higher than your elbows, kind of like you see in all those surgical shows. Making sure that you're not going to splash your scrub clothes because the dampness can later moisten the sterile gown. And remember, dampness can be considered contamination. You'll then use a second brush and more soap and actually start scrubbing. So first we did a lather, now we're actually going to scrub. The prescribed number of brush strokes is about 15 to the nails and each hand, and 10 strokes to each area of the skin. So scrubbing itself should take about 5 minutes. So it's a pretty thorough process. You'll want to scrub your fingers and hands, each of which have 4 sides if you consider like a medial, lateral, anterior, and posterior side. and scrub each of those 4 sides effectively, starting with the fingernails, and then working your way into the fingers, palms, and backs of hands. Divide your forearm into thirds and use more of a circular motion on those, up to the elbows, 2 inches above the elbows. Then you'll keep your hands above the elbows while scrubbing, and add small amounts of water as needed to maintain a good lather. When it's completed, you can discard the brush, and then you'll rinse pretty thoroughly. Keeping your hands above the elbows and away from your body, then you'll enter your surgical suite. You'll have to dry by grasping the corner of a sterile towel and step back from the field, allowing the towel to fall open, bend forward at the waist, and hold your arms away from your body and above your waist. Essentially, this is all say that once your hands are wet and you're drying them, and once you have fully scrubbed all the way up to 2 inches above the elbows, we need to keep the arms always above the waist and in front of you, because that is part of the sterile field. You'll then dry your hands and then your arms thoroughly, and you can rotate the towel as required, taking care not to contaminate the sterile field, the towel, or your hands. If you bring your hands or the towel below your waistline, they are now contaminated, so be sure to not do that. Once you have thoroughly scrubbed your hands, you can do sterile gowning with the closed glove technique. There's also an open glove technique. So with an assistant, they'll open the gloves and the sterile gown pack. You'll lift the folded sterile gown, step back from the table, and allow the gown to unfold with the inside of the gown toward you. You'll put your arms in the sleeves, but do not allow your hands to protrude through the cuffs. The assistant will fasten the gown at the neckline. And then with your dominant hand remaining inside the sleeve, you'll pick up your glove with the non-dominant hand, inserting your non-dominant hand into the glove. You'll stretch the glove over the cuff of the gown, and with your non-dominant hand, pick up the second glove. You'll then stretch the cuff of the glove over the cuff of the gown, and then closed gloving is complete. So once you have your sterile gloves on, still keeping those hands above the waist in front of you in that sterile field, you can separate the waist tie from the gown and pass tie with tab to the assistant. Turn in a circle so that it effectively wraps around your waist. A sharp tug on the tie itself will separate it from the tab, allowing you to fasten the tie without contaminating the gown. So a lot of this is pretty wordy, but it'll be a lot more simple when you can actually see the gown and do this process. I can't imagine that you'll be doing it a ton unless you're working in a place that really utilizes their rad techs or sonographers in their OR, in which case you may be doing this often. But the more you do it, the more used to this process you'll get. Another option is an open gloving technique, which is something you may have seen somebody do before. So this is kind of what that sterile pack of gloves looks like. You'll perform hand hygiene as we previously described, obtain the gloves, get the right size, open the outer pack to remove the inner folded wrap, and then expose the gloves with the open ends facing toward you. Notice that they already have kind of a cuff on them, so it'll make it a little easier to get your hand inside that glove without contaminating the outer surface of the glove. So with one hand, you'll grip the cuff fold of the glove for the opposite hand. So if you're going to glove your right hand first, you can take your left hand and grab the right glove. Put on the first glove, touching only the inner surface of the folded cuff. And then using your gloved hand, you can grasp the second glove under the cuff and insert your hand into the second glove. Once you've put on the second glove, you can unfold the cuff and insert your fingers under the cuff of the first glove and unfold the glove. So essentially, we're just partially putting on that first glove in order to grasp the second glove. We can fully put on the second glove, and then we can fully put on the first glove. So there's a whole video that shows how to do that. That's posted under D2L. Then gloving is complete, and again, keeping your hand in that sterile field to avoid contamination. There are times when you might have to dress or undress wounds. To remove dressing from a wound, you'll perform hand hygiene, don gloves, they don't have to be sterile gloves, and you'll inform the patient of what you're about to do. You'll use care to remove the dressing to prevent cross-contaminating the wound and yourself. Remove it gently. It does have adhesive on it, so you don't want to rip the Band-Aid off the patient. You'll place the soiled dressing in an appropriate biohazard container and remove your gloves following the same procedure that you used with isolation techniques we spoke about prior, and then perform hand hygiene once more. To perform a sterile dressing, that's when you'll need sterile gloves. So you'll get sterile gloves, sterile drape, sterile gauze, tape, and normal saline for washing the wound. When the supplies are assembled, you then can start your process here. So again, hand hygiene, telling the patient what you're going to do. You'll take several strips of tape to a convenient length depending on the size of the wound. Open the sterile pack and place the drape near the patient. Open the drape, pulling from the corners, creating a small sterile field for where you're going to work. Then you'll open the dressing package as we've shown previously and add the sterile dressing to your sterile field. You can cleanse around the wound. Drop your sterile gauze sponges into the field. To moisten them, you can open a small vial of sterile normal saline and pour a small amount of saline over the sponges. You don't want the liquid to soak through the sterile towel. Remember, dampness can be contamination. You'll check the label 3 times throughout this process before discarding the vial to ensure that it's the correct label and that it is to be used for this purpose. You'll don sterile gloves and then use the open method for sterile gloving as we described previously. You can apply the moist sponges to clean the area around the wound, allow it to dry completely before putting on the actual dressing. You will then secure it in place with tape, cover the patient, dispose of any waste in appropriate containers such as biohazard containers if needed, and remove your gloves and then perform hand hygiene once more. So it's pretty specific. There's a little bit more in the chapter itself about how to maintain a sterile field. Don't forget to take your quiz for this week. It's listed under D2L week 10/11.